What is uric acid? Before you start taking actions to lower uric acid levels naturally, it's important to understand what uric acid is, where it comes from, why high levels can lead to gout, and why you need to reduce high uric acid levels in the blood. So, first things first, what is uric acid? Uric acid is a byproduct of the chemical breakdown of compounds called purines that exist in our body cells and in our food. Purines are very important to us because they provide energy and protein, among other important components. During those processes, uric acid is produced in the bloodstream. Uric acid is good for us because it acts as an antioxidant and helps look after the internal linings of our blood vessels. It's our kidneys' job to process the uric acid produced and excrete waste out of our bodies through our urine, or also a little through our stools. What causes high uric acid in blood? While the kidneys usually maintain uric acid at healthy levels, there are times when they are unable to do this. In turn, what results is that excess uric acid is retained in, and circulates in, the blood. Two of the main causes for high uric acid levels in blood are: 1. The kidneys aren't working to their full potential. They are unable to process and expel sufficient uric acid quickly enough, or 2. There is too much uric acid being produced by the metabolizing purines for healthy kidneys to process. Whatever is the case, the result is high uric acid in the blood. What is the result of high uric acid levels in the body? Hyperuricemia. High uric acid levels in the blood is a condition known as hyperuricemia. Over time, this can lead to the production of uric acid crystals. Technically speaking, these are crystals of monosodium urate, which can settle in the joints, tendons and surrounding tissue. The body reacts defensively. The crystals are needle-like in shape and are looked upon as foreign objects by the body's natural defenses. In turn, the body's natural inflammatory processes working against these crystals are what actually cause gout symptoms such as redness, swelling, heat, inflammation, stiffness, and very great pain. These are the symptoms of a gout attack. In other words, high uric acid can lead to gout, which is why it's important to decrease uric acid levels in the body. High levels of uric acid are associated with gout and an increased risk of uric acid kidney stones. High levels of uric acid in the blood is known as hyperuricemia and may be detected using a blood test. 1. If you have high levels of uric acid in your blood, then there are several dietary changes you can make. Make sure that you follow your doctor's instructions first and foremost. Limit purine-rich foods. The best way to reduce uric acid levels is to limit the amounts of purine-rich foods in your diet. 2. Purines are chemicals that form when your body breaks down certain types of food, but a high level of purines can lead to conditions like gout and kidney stones. 3. You should avoid purine-rich foods if you have had gout or uric acid-containing kidney stones or if you have a family history of these conditions. Do not exceed more than 2 to 4 servings of any of these foods per week and avoid them completely during a bout with gout or if you have uric acid-containing kidney stones. Purine-rich foods to limit or avoid include: 4. Beer and liquor. Sugary soft drinks. Fatty foods such as fried foods, butter, margarine, and high-fat dairy products. Organ meats such as liver, kidneys, and sweetbreads. Beef, chicken, pork, bacon, veal, and venison. Anchovies, sardines, herring, mussels, codfish, scallops, trout, haddock, crab, oyster, lobster, and shrimp. Increase your intake of phytate-rich foods. Phytate is a substance that seems to prevent the formation of many types of kidney stones, including those caused by uric acid. Include 2 to 3 servings of phytate-rich foods every day. Phytate-rich foods include 5. Beans, legumes, whole grains. Include dairy products in your diet. Make sure that you include calcium-rich foods in your diet, such as low-fat dairy products. Include 1 to 2 servings of calcium-rich foods per day. Calcium-rich foods include 6. Milk, yogurt, cheese. Eat vitamin C-rich foods or add a vitamin C supplement. Getting enough vitamin C may also help to lower uric acid levels. Try eating a couple servings of foods that are rich in vitamin C each day, or talk to your doctor about including a vitamin C supplement to help lower your uric acid levels. 7 foods that are rich in vitamin C include 8. Citrus fruits such as oranges, grapefruit, lemons, and limes. Kiwi fruit. Berries. Cantaloupe. Pineapple. Mango. Papaya. Broccoli. Peppers. Sweet and white potatoes. Tomatoes. Leafy greens such as spinach, cabbage, and turnip greens. Cauliflower. Winter squash. Stay hydrated. Drinking plenty of water can also help to reduce uric acid in your blood. For most people, the recommended amount is 6 to 8 glasses of water every day. Talk to your doctor for a specific recommendation on how much water you should be drinking every day. Drink green tea. Green tea has been shown to decrease the risk of uric acid-containing kidney stones. Try to drink about 2 to 3 cups of green tea per day to help lower your uric acid levels. Sip some tart cherry juice. Tart cherry juice has long been used in naturopathic medicine to treat gout and kidney stones. If you have an attack of gout, drink 3 to 4 8-ounce glasses or organic, tart cherry juice. This should provide some relief within 12 to 24 hours. Eating cherries can also help. Try including a serving of cherries in your diet each day. Include a moderate amount of coffee. Drinking coffee in moderation has been shown to decrease uric acid in your blood. Try to include a cup or 2 of coffee per day to help lower your uric acid levels. See a doctor if you have gout or kidney stones. If you have had gout or uric acid-containing kidney stones, or if you have a family history, make sure that you see your physician regularly. Don't wait to see your doctor until these conditions begin causing serious problems. Seeing your physician early can help prevent many issues and can help you make good choices for your self-care. You can safely make dietary changes on your own, but it is always best to keep your physician informed of your self-care approaches. Watch for symptoms of gout. Gout is a painful arthritic condition that results when uric acid salts deposit in joints. The most common joint in gout is at the base of the big toe, but it can also affect the joints of the feet, ankles, knees, hands, and wrists. The joints affected become red, inflamed, swollen and painful. It occurs more often in men, but postmenopausal women have a higher risk as well. Determine if you have kidney stones. Kidney stones can form from uric acid and can cause kidney damage and disease. 13. Uric acid-containing kidney stones can be very painful and are the most common type of kidney stone in children. 14. Kidney stones may cause significant symptoms which include 15. Severe, sharp pain, nausea, vomiting, blood in the urine, sweating, fever, cloudy urine. Learn about risk factors. Even though diet plays a major role in uric acid levels, anyone can have high levels of uric acid in the blood. Adult men and postmenopausal women have the highest risk. Other risk factors include 16. Obesity or being overweight. Untreated high blood pressure, diabetes, metabolic syndrome, heart disease, and kidney disease. Some medications including diuretics, low-dose aspirin, immunosuppressant drugs. Family history of gout. Recent surgery or trauma.